Temple University SNPhA presents Prescription for Service. Our Prescription for Service initiative is Respiratory Rescue, a breath of fresh air for the Philadelphia youth. National asthma prevalence. Approximately 7.8% of children in the U.S. have asthma, with 8.4% of children under 18 having asthma, compared to 7.6% in adults 18 plus. Puerto Ricans and non-Hispanic African Americans are more likely to have this disease than non-Hispanic whites, and the prevalence of asthma varies by state. Asthma prevalence in Philadelphia. According to a report by the Asthma and Allergy Foundation of America, Philadelphia ranks 11th out of 100 U.S. cities in estimated asthma prevalence. They also estimate that roughly 22% of children ages 0 to 17 have been diagnosed with asthma in the city of Philadelphia, with other reports projecting asthma rates up to 28%. Asthma demographics in the city of Philadelphia. Of 24.6 middle school age children who self-reported with asthma, 30.7% are Hispanics, 25.4% are African Americans, 19.8% are whites, and 15.9% are Asians. According to a 2002 study of 5th and 6th graders across 57 public schools in Philadelphia, results have found 24.6 self-reported as having asthma. Why this service? The North Philadelphia community is a largely minority and low-income population. Middle school students in this area lack access to asthma care, as evidenced by the uncontrolled asthma rates in North Philadelphia. The Respiratory Rescue initiative will alleviate asthma exacerbations in these students through inhaler technique education, pest and trigger control supplies and education, and assessing proper asthma regimens.
Our partners. The first one is Asociación Puertorriqueños en Marcha for Everyone, Children's Mission, and Public Health Management Corporation. APM is a nonprofit organization dedicated to improving the quality of life of our community. Health services. The APM provides healthcare providers, psychiatrists, therapists, case managers, peer support specialists, and other staff who work together as a single team to care for the Philadelphia community. Children's Mission is a nonprofit organization that assists low-income seniors and children in the North Philadelphia area. Children's Mission also partners with Temple University School of Pharmacy to provide health talks, events, and health screenings to the low-income community. PHMC is a nonprofit public health institute that builds healthier communities through partnerships with government, foundations, businesses, and community-based organizations. It fulfills its mission to improve the health of the community by providing outreach, health promotion, education, research, planning, technical assistance, and direct services.
Our inspiration. Our inspiration for the Respiratory Rescue initiative is Dr. Miklich. She's a member of the Temple University School of Pharmacy faculty and a practicing pharmacist. As part of her residency training at University of Maryland Medical Center in Baltimore, she provided pharmacy services on the Breathmobile. The Breathmobile is a custom-built pediatric asthma and allergy clinic that travels to over 24 schools, providing ongoing asthma and allergy care to children. It's been in the operation since 2002. When the University of Maryland Children's Hospital created the East Coast's first Breathmobile. Inside the Breathmobile, there's a small waiting area, a testing area, and 2 exam rooms. The asthma team includes a pediatric allergist or pulmonologist, a pediatric nurse practitioner, a registered nurse, and a driver. Our model: asthma for middle school students in the North Philadelphia community. The Respiratory Rescue initiative will provide spirometry tests, proper inhaler use counseling, and educational materials. Our mobile van will provide spirometry testing to identify children with undiagnosed or uncontrolled asthma. It will be equipped with pharmacists and pharmacy students to evaluate students and demonstrate to them on how to use their inhalers. We will be providing asthma kits for the students that will include general asthma health information, peak flow meter, allergy control information, masks with information on use, pest control traps, public health asthma control calendar, hand sanitizers for cold control, and second-hand smoking information. Existing services. PHMC currently partners with the Philadelphia Department of Public Health to supply asthma educational materials to public school students. PHMC supplies asthma trigger calendars and informative pamphlets on pest control as well. PHMC also provides families with pest control supplies to help mitigate asthma exacerbations.
Timeline. Step 1. Visit middle schools in the North Philadelphia community to share information on our Respiratory Rescue initiative. Step 2. Assemble a schedule of school visitations, including available preceptors and pharmacy student volunteers. Assemble asthma exacerbation kits and asthma educational materials. Step 3. Travel in the Respiratory Rescue van to North Philadelphia middle schools. Budget. We will be getting the mobile van from the Temple University Hospital. We will be spending the $2,500 on the following items. First, educational material on general asthma and asthma exacerbations, including an asthma control test. 2, asthma kits for students, which will include a peak flow meter, asthma log sheet, spacer, hand sanitizer, alcohol swabs, and instructions on kit use. And finally, pest control traps. SNPhA's vision. SNPhA's purpose is to plan, organize, and execute programs geared toward the improvement of the health, educational, and social environment of the community. Respiratory Rescue's mission. The Respiratory Rescue Initiative will help reduce asthma exacerbations for 5th to 8th grade students in the Philadelphia community who are struggling with asthma control. In summary, Temple University's Respiratory Rescue Initiative will teach Philadelphia middle school students proper inhaler technique and asthma trigger control.